Hello and a very warm welcome to Reiki Teddy. I'm here to talk today about non-pharmacological interventions which are aimed at reducing behavioural and psychological disorders with patients. Now, these patients could be mainly people with dementia, Alzheimer's. And what are non-pharmacological interventions? Well, as it says, when you've got someone who's suffering from dementia or Alzheimer's or mental health problems, rather than treating them completely with medicine, there are other interventions that one can use. And when you use an intervention that is not using drugs, it's called non-pharmacological intervention. And one of these interventions are well-known studies into doll therapy. Doll therapy, yes. There are lots of studies. There are even books. There is a well-known book, so I've got to read it so I don't get it wrong. It's called Doll Therapy in Dementia Care, and it's the evidence and practice, and it's by Gary Mitchell. So there are actually books done on doll therapy. And what is doll therapy? Well, it's not just dolls, because it's dolls, cuddly toys, teddy bears. Someone might have a favorite rabbit, but it's mainly dolls and teddy bears that they've used this, because most people associate dolls and teddy bears. And what is it? Well, the benefits. The main benefit they have found when people are working with dolls and teddy bears, they find it decreases anxiety. It helps to relieve agitation. They find that people, when they're playing with their dolls and their teddy bears, it raises their happiness levels. It also helps with social interaction, because when they're holding the teddy or the doll, they're talking about it, and what they're doing is they find it takes them back to when they were a childhood, and people can remember things about their childhood and their past life, and having a doll or a teddy reactivates these past memories, and they will use them and they will talk to them about their childhood, and they go, oh, can you remember when you were little? Oh yeah, I had a little girl and I had a pram, and the pram had a blue hood and red wheels, and I used to take it for a walk to the park and everything. And it's helping people connect with past memories. It also helps them to recover, to receive care, because when they are giving love and attention to the teddy, they are receiving love and attention. And usually when they're in the middle of having a doll therapy or a teddy bear therapy, there's usually a therapist there as well, and they're having a talk and they're having a conversation. We found that it removes negative conversation words, because they're holding a teddy and they're talking about love, and they're using positive words rather than negative words. Very few people, so I'm looking at the teddy, very few people say negative things when they're holding a doll or holding a teddy. So it's increasing their endorphins. It has found, having doll therapy, teddy therapy, that it improves their mood levels. It also, they find it has decreased obsessive behavior, because when they're sort of like obsessive like this, when they've got a doll and they're holding it, it distracts them, and they've got something to occupy their mind. And they often find that when they've got a doll or a teddy, they find that it reactivates their life. Sorry, I keep looking at the teddy. See, it works, doesn't it? Because it's distracting me. And they've actually found that some people, when they've got a doll sitting there, they've actually done what they call tea parties, doll tea parties. And they have the dolls sitting around, and the person will interact with the tea party, and they can actually get the person to eat cake and sandwich because the doll is having a tea party. Some people say, I'm a little bit concerned about doll therapy. Should we be treating them as a child? No, you are not treating them as a child, like, oh, I've got my teddy. No, it's not that. You are not treating a person like, oh, you're a baby, you're a child, even though they're 80, 90 years old, or even someone who's 50 or 60 with dementia or Alzheimer's. You're not treating them as a child, because this is a type of treatment. And what it is, it's an interactive treatment. Yes, some families have expressed concern that they have walked into the residential home and found grandma, mainly grandmas, but there are granddads, holding a doll and they're going, what are they doing? What are they doing? Because they don't understand the therapy and the non-pharmacological intervention that is going on. And they think, oh, are you not valuing my mother, my father, my uncle as a valued adult because they're holding a cuddly toy? But when you explain to them that actually it is not a toy, it is a non-pharmacological intervention, they actually suddenly understand what's going on. And sometimes people not quite realizing that, oh my goodness, their family member have got an extended cognitive behavior pattern. And it's a bit of a shock when they go in and they find them holding a teddy or a doll, and they think, wow, what's going on? And when they explain, well, it's because it's helping there with their mental, and they go, really? They've got a problem. Sometimes it's a shock. So it is sometimes funny. But once you explain to the family what is going on, that there is a non-pharmacological intervention going ahead, helping these people with dementia, helping people with Alzheimer's, helping people with memory loss. So it could be anyone. You could have someone who's a young person and they've had a head injury and they got memory loss, using a non-pharmacological intervention. And yes, we use teddy bears. Why? Why do we use a teddy bear rather than a doll? Mainly because of men. You don't want to walk in and see a man holding a doll. But what could happen is they're cuddling a toy. Yeah, it's perfectly okay for them to hold a cuddly toy. Maybe not a doll, because it's the family who are thinking, oh, what's going on while they're holding a doll. But the other thing is, most people like the soft feel, its texture, the softness of a cuddly toy. And that is why they use teddy bears as well as just dolls. Yes, with women, they do actually use dolls, because it sometimes takes them back to when they were a mother and they associate the doll as their baby, and they go, oh, did you have a baby? Yes, or I had a child, I had a daughter or a son. And then they can talk about it, and what they do, they interact, because you can have male dolls and female dolls, so they can interact. So they said, can you remember when you had your son? And they got it. But having a teddy bear or a soft animal is the texture, and everyone loves to have a cuddle, and because it's softer to cuddle as well. And any age, you can give a teddy bear to anyone. Okay, so you can use Reiki Teddy as part of doll therapy. And I have found that I have got a number of clients, mainly they are the family member who has bought it for their elderly patient, or their elderly relative, They have bought it for a member of their family who's had a head trauma. So it is the family member who is buying the Reiki Teddy, because it is part of a non-pharmacological intervention therapy. And cuddly toys, everyone likes, you've seen that when you go to hospitals, you have the cuddly toys. When a baby is born, people give a cuddly toy. It's Valentine's. Guys give their girls cuddly toys. Girls give their boyfriends or husbands cuddly toys, because it is a sign of love. And there is so much research gone into doll therapy, the non-pharmacological interventions, and they have found it does help reduce psychological disorders, specifically with dementia and Alzheimer's. So have you thought of doll therapy? Have you got a relative in a residential home? Have you got a family member who has had a head injury and got memory problems? Talk to your medical practitioner and say, what about doll therapy? What about teddy therapy? cuddly toy therapy. And they might go, what's that? There is so much research going on about the benefits of cuddly toys and dolls in helping people with dementia, Alzheimer's, head injuries. It's calming, it's relaxing, it helps them with anxiety. And like I said, I've got some information here. There are articles from Freudia's in Psychology magazine dating back to 21st of April 2014 talking about the benefits of doll therapy and teddy bear therapy. And it helps so many people with their behavior, with their mood, with their emotions, with their cognitive development, with their social ability to socialize with people. And they are actually now doing work with children who have got ADHD, who have got autism, and it's the same thing. When a child has got autism, they have found that it helps when they're having a meltdown, a breakdown. You know, even an elderly person, when they're having a meltdown, and go, give them their teddy bear, give them their doll. It calms them down. And I've got, so many children, their parents have bought them a Reiki teddy because it just calms them down. And it's like when they're stressing, have a teddy, have your favorite doll, have your favorite toy. Some kids use their favorite car, they have a fire engine or anything like this. But they found that having a soft toy really helps, because if that child is getting angry, they can't hurt themselves with a cuddly toy. They might hit themselves with their fire engine, boom, 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 hurt themselves. But when they've got a teddy bear and they're getting stressed and anxious and everything, having a teddy bear in front of the child who is having a breakdown, get them to look into the eyes of the teddy bear. Because, you know, when you sort of say, look in my eyes, look in my eyes, look in my eyes, look in the eyes of the cuddly toy, it sort of gets them to focus and they've got something soft and tangible to hold. And it gives them comfort. And of course, a Reiki teddy, the bear with a healing hug. So if you have got anyone who has got in your family who has dementia, Alzheimer's, they have got head injuries, they've got memory problems, and you want to help calm them down to bring happiness into their life, help them with their cognitive behavior, help them with their memory, and like I said, it helps increases their level of communication with them. With children who've got ADHD, who've got children who are autistic, learning behaviors, doll therapy is a recognized therapy, part of a non-pharmacological intervention, and it is aimed specifically at reducing behavior and psychological disorders, and it's with all patients. So there's a lot of different research available on the internet. You're welcome to Google it and find the information for yourself. Like I said, if you look at Frontiers in Psychology, they've got a lot of research. There is the book, Doll Therapy in Dementia Care by Gary Mitchell. There are lots of books, there's lots of articles on doll therapy. So if you have got a person in your family who you think could benefit from doll therapy, teddy bear therapy, look into it, because this is something that people aren't aware of. And like I said, it's a non-pharmacological intervention. It's not drugs. And everyone just uses, they're getting anxious, give them some medicine. How about a non-pharmacological intervention? Sending you so much love from Reiki Teddy. Have an absolutely awesome day, and I hope you found this of interest. If you are interested in getting a Reiki Teddy for one of your family members, please do not hesitate in contacting me. Take care. Angel blessings. Namaste. Bye now. Bye.